Hello everyone. My father is currently in hospital. Hopefully he will be there for at least a couple of days. Because going to the ER, being given first aid and telling go find yourself a place where you can be operated, that's not good enough. I'm sorry. So there is hope that when he goes to the ER during the day, and they already talked with doctors there, that they might ask someone to come from urology and examine him and possibly make him, stay there. I hope that also doctors from when it comes to stomach, duodenum, and all the other stuff, he will have a tomography. So since he needs a bladder tomography, they can also do the rest. And I am mostly worried about hernia because he has had like extremely painful blockage, and not at the end, if you know what I mean. So if possible, I hope that the tomography will include also the whole belly area. I forgot how it's in English. Yeah, because it should be visible. Hernia will be visible on CT. So I'll be back in a moment. Also, I'm back. So thankfully, the catheter he has now is slightly smaller than previously, but I don't know if I would call 20 French catheter small. French is thankfully a very, very simple unit of measurement. It's 1/3 of a millimeter in diameter, outer diameter of the catheter. So 20 French catheter means 6 2/3 millimeter of outer. I forget the word radius. Not radius, of outer diameter. If I remember historically, it was like in 1870s, maybe even 1850s, after the introduction of anesthesia, but before the introduction of antiseptic and aseptic treatment. And anesthesia, and they only had back then full anesthesia. They didn't have local ones, so it was done without usually, or with mild global anesthesia. So basically you were like having a bit of an opium under your tongue, so not fun. And they needed instruments. That was in France. They needed instruments to put inside the bladder, to put something that can hold gallbladder, and also they needed to put a scalpel inside to cut it apart so that it would become small enough that it could be peed out. So they basically had like very, very small utensils to, a bit like for if you're a geologist and you're interested in small rocks, basically something like that, but for medicine. That's how it looked. Okay, I'm gonna be back in a moment. Okay. What was I talking about? Yes, France and the beginnings of medicine. So yeah, that wasn't the first operation, Western operation. I do want to say that in India there were people who operated, I don't want to say wrong stuff, gallbladder? Basically like kidney stones that are in that are not inside the part of the body that, if infected, it was death before the age of antiseptics and aseptics, and before that you would treat right now, that would be sepsis, and you would treat it with antibiotics. So, I don't know. In Polish it's called otrzewna, and it's basically like a bag around body, torso, like around all those structures inside. So the first people who operated, they were English people who operated. They were stationed in India actually, and there was a guy who inserted himself with very long made and specially made for him scalpel, and managed to grind down the stone to manageable size. Have fun. I'll be back. Yeah, so I got last of the slightly cheaper diesel. Okay, history of medicine. Oh boy. I know that's not a very comfortable subject to talk about, what I just said. But it shows you how insane the pain is if someone is willing to go that far. The Indian, specifically medicine, was they used knife. They just cut from below and removed stuff. and there was some kind of suing. I don't know the details, but basically patient either survived or not. And yes, the guy who wrote that history, yeah, he was a Western. He was biased, but he also was back then living there. So while he did prefer Western methods because they were more survivable, he even understood that from pure logistics it would be impossible to, country as gigantic as India, even if you could convince all the doctors to, get all the newest stuff. And remember, newest stuff in terms of urology back then when he visited India or talked about visiting India. That was last 10 years, so maybe you had like in Bombay or somewhere, maybe you had like an instrument that was newish and could be used, but not newest generation. So he recognized that this, helped a lot with people surviving, because less than 1 in 20 people died or had some kind of big problems. Most people, recovered after a while. You are still making a cut into a place that you shouldn't, and you might still get some kind of sepsis. Well, you will get some kind of sepsis, but in this case it's localized. So if it's done well, fast, relatively, clean stuff, then yeah, you can do it and it shouldn't spread. It's different than cutting from the front, below all the muscles and all this stuff. So yeah, it's called the second part is Triumph of Medicine, but the first part is 100th Century of Medicine. There is also Century of Detectives, which, yes, it talks about detectives, but it's mostly about forensic medicine. So written by Jürgen Thorvald, and it was mostly taken from what his grandfather, who was a medical student in Massachusetts, I think, in 1843. He was, as a student, he witnessed the first operation done under, anesthesia. So yeah, okay. Goodbye, take care. Like, share, and subscribe. Bye.